Good morning. Thank you for tuning in to WBAI for the second of 5 shows on New York City Communities in Focus with the New York Women's Foundation. NYWF is very excited to bring you conversations with some of our grantee partners serving women and families in communities across all 5 boroughs of New York City. My name is Gail Black. I'm the Public Communications Manager at NYWF, and I will be moderating these conversations. The New York Women's Foundation is a cross-cultural alliance promoting economic security for women and families in New York City. The foundation uses a participatory grant-making approach, engaging women from all walks of life across New York City to identify and support the most effective community-based solutions. Our grantee partners are community-based organizations that address a wide variety of issues, including workforce development, violence prevention, and reproductive justice, in order to address the complex challenges facing the women and families in greatest need. The foundation also engages in partnerships and public education initiatives like this one with WBAI in order to advance its efforts and highlight the work of our grantee partners. In our continued efforts to bring voices and perspectives to the show that are often left out, today's conversation will focus on issues facing the LGBTQ community, with a particular focus on youth and transgender and gender nonconforming individuals. NYWF works with the LGBTQ and gender nonconforming community on issues specific to their needs, and today we are being joined by 3 outstanding community leaders to talk about that work. Our first guest is Erica Cardwell, the Assistant Director of Arts and Culture at Hetrick-Martin Institute. Hetrick-Martin Institute believes all young people, regardless of sexual orientation or identity, deserve a safe and supportive environment in which to achieve their full potential. Thank you, Erica, for joining us.
Thank you for having me.
Our second guest is Dahana Perry, the Transgender Case Manager at Callen-Lorde Community Health Center, a medical facility for the lesbian, gay, bisexual, and transgender community, as well as people living with HIV/AIDS. Thank you, Dahana, for joining us.
Thank you for having me.
And later on in the show, we'll be joined by Sheilah R. Sable, Director of Community Education and Outreach at the Empire State Pride Agenda. The Empire State Pride Agenda is New York's statewide lesbian, gay, bisexual, and transgender civil rights and advocacy groups. So my first question is for the both of you, Erica and Dahana. So when discussing the LGBTQ and gender nonconforming community, what are some foundational terms and concepts that folks should be informed of?
Sure. So I work primarily with the transgender and gender nonconforming community, and I think that on a basic level, a lot of people get a couple of terms kind of conflated or confused. And a lot of that has to do more with confusing sexual orientation and gender expression or gender identity, and those two are actually separate. So, I think it's important for people to understand that sex is kind of your biological assignment. Your gender identity is how we understand our gender, kind of inside. And gender expression is how we express our gender, which is completely separate from sexual orientation, which is the direction in which you have sexual affection or romantic affection.
Great. And I also think that if we're going to begin this conversation, we need to start with an understanding of intersectionality. And from my perspective, intersectionality is the study that systems of oppression are inherently inclusive, and that one's disadvantage cannot be deconstructed without understanding these intersections. So for myself, whenever I look at Black womanhood, there's no way to look at womanhood without looking at Blackness and looking at being a Black woman and being first Black and then a woman, or first a woman and then Black, that these two things must intersect in order to be understood, but also related to and also supported.
Furthermore, I think it's also important for folks to understand that sometimes in terms, especially for gender nonconforming folks, there's no point A to point B necessarily, that, gender identity really exists on a continuum, or some people might even describe it differently than that, but that, there are some folks that kind of maybe hang out in the middle a little bit, or just don't identify with either gender, and it's really important to understand that distinction.
In addition, I think that there's 2 terms that are really prevalent within the LGBTQ community that I think would be helpful if they were a bit more mainstream, and I've been seeing them pop up in other spaces. We've been speaking a lot about transgender, but I think a lot of folks need to understand the distinction between biology and cisgender, and really sitting within an understanding of cisgender, and cisgender being that someone who identifies with the gender they were assigned with at birth, and transgender being someone whose gender identity is differs from what they were assigned as at birth. I think that can liberate a lot of conversations and could offer some clarity around it, the conversation around psychology and whatnot, and more about what you were saying about an internal gender identity.
Right.
Excellent. Thank you both so much. So, Erica, I'd like to start with you. Can you talk a bit about the history and mission of HMI?
Absolutely. The Hetrick-Martin Institute is the oldest and largest nonprofit agency serving LGBTQ young people. We celebrated our 35th anniversary last year. We're within our 36th year. And we have a comprehensive package of services. We offer a wraparound menu, I guess. We have free counseling, GED classes, HIV testing, STD and STI testing. We have a food and clothing pantry that has a washer and dryer and a shower. We serve dinner every night at 6 p.m. And we have multiple leadership and internship programs. So we offer peer education programs where youth go out into their community and educate about sexuality and identity and a lot of the things that we were just speaking about. We also have an expressive arts program that offers therapeutic creative practice and allows youth to sort of work out any of their mental health challenges. And we have a Women Speak program, which is a big part of why I'm here today. It's a space for our young women-identified leaders to come together from various aspects of the LGBTQ spectrum. Lesbians, queer girls, transgender women are all in the room, and we develop a zine together. It's an anti-violence project where young women are able to put down their feelings, their fiction, their nonfiction, their poetry, and express themselves and really be heard on their own terms.
Excellent. And what would you say are the top challenges facing LGBTQ youth?
Coming from our own data, our own in-house data, 36% of the youth at intake report at least one suicide attempt, and 28% are suffering from depression. And so I think one really major and magnified, I guess, component to the LGBTQ community of youth is how much we are challenged by our mental health and how difficult our emotional survival is on a consistent basis, and that this is a really vital part of our framework and that it's rarely being accessed. I feel as if we spend a lot of time looking at education resources and housing resources, but mental health is something that's kind of seen a little bit below those notches, and I think all of these things are mutually exclusive and inclusive, that we wouldn't be able to adequately complete school if we weren't if we didn't have a healthy mental perspective and emotional perspective. 11% of our youth have shared with us that they don't have someone to talk to, that they need emotional support, and that's a big part of why they come to our space. At Hetrick-Martin, we really honor this approach to mental health, and our supportive services department is viewed within the same tiers as our academic enrichment and our job readiness and our arts and culture and health and wellness. We view emotional wellness as a key component to our youth survival and also their identity.
And, the idea of mental health has been part of kind of a broader narrative nationwide. Could you talk a little bit about kind of your response and your work at HMI regarding mental health?
I would say that within our women's programs specifically, and within most of our internship programs, mental health counseling is a component of all of these programs. So we don't mandate counseling if a young person is involved with one of our internships, but we do involve a counselor when issues arise. And even before issues arise, we have a supportive, a support group within, usually monthly, within our internship programs that allows the counselor to be in the room, really destigmatizes that space, and lets the internship facilitator step out and allows the youth to create a relationship with their counselors, so that counseling isn't seen as, in the ways that communities of color typically view counseling, as something that is seen as weak or too vulnerable or inaccessible, and more of as something that should be a component to a healthy lifestyle, and that we all deserve to talk about our feelings but also seek support for those feelings.
Excellent. And going back to my original question about challenges facing LGBTQ youth, what would you say is another major challenge?
I would also say that policing is a huge challenge within our community. It's something that we face in regards to gender presentation. It's something that we face within sexual orientation. Last summer when we were creating our zine for Women Speak, it was happening right at the time that Mike Brown was murdered. And so our space was really, really intense. The energy was really heavy with not only feeling sad about the inevitable racial climate, but also feeling like they related to Mike Brown. A lot of our masculine presenting young women feel targeted every day and have had their own experiences with police brutality that don't make it into mainstream media. And so there was some intense emotion in that room when we were creating, and it really fueled the pages of our zine, which is called Raindrops. One of the young women said that we're going to call it Raindrops because all the bad things can be washed away and things can become new when the rain comes. So there's the criminalization of young LGBTQ individuals is something that just about every single youth member that walks through our doors has faced or will face. And it's a really pervasive aspect of our communities. I mean, and the actions that are being done against stop and frisk and against any of the no condoms as evidence and whatnot are supportive, but I think it's also what we've learned. The best way to support young people is to give them healthy tactics on how to interact with the police and how they can work on their own emotional standpoint and their immediate response, coming from a space of a lack of support and deciding to respond differently in respect for themselves and having a broader perspective and not personalizing each incident, because a lot of the arrests, the youth are being targeted, so they're inevitably going to be arrested. So a lot of times the arrest maybe could be avoided if more young people knew their rights, and that's where our work comes in. And
what's an example of, kind of directives and advice that you give them in terms of police interaction?
One main thing that I tell youth is that they do have the right to remain silent, that they don't need to adhere to what the police are telling them, but they also don't need to defend whatever's being accused, that they can find a way to breathe. It sounds so simple, but finding a way to breathe in moments when the police are really antagonizing a young person and to disengage the power is really, really important. And that's something that I try really hard to put out there.
Absolutely. And, from seeing your work on the ground and with the youth directly, what more can be done to better support your work, their needs?
I think that there's been a lot of conversations around allyship in the past few months and how to be a good ally. And I think that one main topic or trend within these conversations is educating allies and having allies take their information and put some action around it. I think what was said earlier about the conflation of gender and sexuality is really critical and is sometimes the detriment of putting images of LGBTQ images within non-LGBTQ spaces and how that can be sort of a misnomer, how we can put the image out there without any kind of cultural integrity, without understanding that these things need to be there needs to be a distinction. So what I'm saying essentially is that there is an incredible wealth of youth programs on a national level, but I think that LGBTQ youth programming is really distinctive, and I think that we need to identify the young people, the young women, the young gender nonconforming folks within our programs, and promote their visibility and bring them to spaces that will continue to help them feel safe. A lot of our youth members are brought to our space because their GSA came on a tour, or because their guidance counselor brought them to HMI because they knew that HMI would be able to provide them with resources that they may not have. And so, yes, I do think that there is a lot of great work being done, but I think information needs to be made visible as often as possible. And within our HMI Center for LGBTQ Youth Advocacy and Capacity Building, we do a lot of this, of educating broader audiences and developing a more culturally competent understanding of how to do youth programming.
Excellent. And then how can folks get involved with your organization and support your work?
You can go to hmi.org, and that's where all of our links to Facebook and Twitter are, and that's how you can get information about what we do. And if you want to just put into your search engine on Facebook, you could put Hetrick-Martin in there, and we'll come up. We have a youth page. We have a lot of different pages for different programs, but you can easily find us on Facebook and Twitter.
Excellent. Thank you so much, Erica.
Thank you.
Now, Dahana, can you tell me about the history and mission of and work of Callen-Lorde?
Yeah, sure. Excuse me. So the mission of Callen-Lorde is to provide sensitive, quality healthcare and related services targeted to New York's lesbian, gay, bisexual, and transgender communities, and all of their diversity, and regardless of ability to pay, which makes us very unique, I think. And to further the mission, Callen-Lorde provides health education, wellness, and advocates for gay, lesbian, transgender, and bisexual health issues as well. The interesting thing about the history of Callen-Lorde is that it's actually named after Michael Callen and Audre Lorde, which is, a really wonderful legacy to have working there. It started over 40 years ago on St. Mark's Community Clinic and the Gay Men's Health Project, and it really kind of grew tremendously. Now it's a pretty large organization servicing over 14,000 patients within New York, and it's growing daily.
Excellent.
Yeah.
And what work does your role encompass at Callen-Lorde?
Sure. So I'm the transgender case manager, so it's kind of divided into two parts mostly. A lot of it is kind of traditional case management work, so helping folks access housing, employment, access to public benefits, basic needs things, food access, things of that nature. And then the other part of my work is very specific to trans needs. So giving people guidance around legal name changes, gender marker corrections on their federal identity documents, and then also surgery planning for those who are really interested in that and pursuing that, and then navigating how to access that with all of the changes happening policy-wise around insurance and kind of, trying to keep up with that for folks. Yeah.
Excellent. And what do you hear from your clients regarding, challenges that they have faced when seeking assistance, healthcare or otherwise, elsewhere?
Sure. A lot of discrimination, a lot of, misgendering when they go to different doctor's appointments, being laughed out of the ER if there's an emergency situation, not being serviced. If your gender markers don't match on your identity documents, you could be faced with a large bill or billing issues. Just access to services in general is very, very difficult in a medical setting because there are many doctors that don't have access, and nurses for that matter, that don't have access to LGBT-specific knowledge around health, and the issues are very, they're really particular to, to the LGBT community. So there's just not a lot of training, I think, on the whole for the medical community. So luckily we have an education department where we're able to send staff to different medical communities and things to do trainings and of that nature. And a lot of what I hear around that is that doctors are for the first time really engaging in LGBT health as its own entity, which is really interesting.
That's excellent.
Yeah.
And what impact has the Affordable Care Act had what impact has the Affordable Care Act had on the transgender community regarding access and quality of care?
Yeah, that's really interesting. I think that the Affordable Care Act, in a way, has kind of opened doors for the kind of changes that we're seeing in New York State right now, particularly with the non-discrimination clause that was embedded in that law that basically made it illegal to keep services away from folks for pre-existing condition, things of that nature. And this is one of those items that's in the law that really protects and helps LGBT people, especially trans people. It's not a complete package. Like there are certain services that are not covered under the ACA on a federal level, but in New York State, that's a very different thing, and those are things that are changing very rapidly over the last few months.
Can you talk about some of those changes?
Yeah, sure. So a few months ago, the governor made an announcement that private insurance companies operating in New York State were now required to offer coverage for trans-identified folks. So that meant, hormone therapy, some surgeries, things of that nature. And then a short while later, the announcement was made for Medicaid as well. Before that, preceding that, Medicare made their changes over the summer last year. So these are all things that are happening very rapidly that are very, I think, very helpful and useful for the trans community. In addition, correcting gender markers on birth certificates has made a significant change in New York State and in New York City, which has been great. They've removed the surgery requirements away from that. So, surgeries are very costly. They're not typically covered by insurance plans, things of that nature. So all of this swift change has happened in the last 6 months or so, and it's been kind of at a dizzying pace to kind of keep up with that. But that's become a major part of my work as well, is a lot of legal work, a lot of policy kind of work, and then, part of that also being just kind of accessing that information and making sure that I disseminate it to the people that I work with.
Excellent. And who are some of your partners in the field? How do you work together to address, the various needs of the members of your community?
Sure. So I think that the relationships with Callen-Lorde are pretty wide, but in my work specifically, I think that there's a large coalition of legal organizations that work specifically in trans-related law, specialize in that. So we kind of work as a team. We meet pretty regularly to update each other on the issues that are happening with our clients, and to share best practices and to increase access. Legal access especially is really important for trans and gender nonconforming individuals. Being trans is largely a legal issue and a medical issue, so having those two things kind of married in my work is really important.
Mm-hmm. And how can folks get involved and support Callen-Lorde?
I think that just having a knowledge that it exists first and foremost is really important. It's a health center, so there's donations I think are useful, and attending events as they kind of show up. But it's kind of an organization that kind of runs on its own, so it doesn't operate on like volunteerism in the way that a lot of other smaller organizations really do. So, but just knowing that the health center is there and letting people know that it's accessible, regardless of ability to pay. It's especially great for the adult population. There's also a youth component as well, that they have their own services that are provided within the organization. So, there's mental health services, there's dentistry, there's primary medical care, there's mental health departments. There's a lot of services that are offered there, HIV testing, of course, and a lot of specialized targeted care that I think is really difficult to find in other places. So you'll find that people are coming from all over the state, other states surrounding New York State as well, to get their care there, because it's just very specific and hard to find in other locations.
Excellent. Thank you so much. And just so folks know, the website is Callen, Callen-Lorde, LORDE.org. And just a reminder, we are on WBAI, streaming live at WBAI.org. And folks can call in at 212-209-2900. We're going to take a quick break, and we'll be back in a few minutes.
I won't pretend. This is my same old coat. These are my same old shoes. It was the same old me
welcome back. Thank you for joining us on WBAI. Before the break, we were speaking with Dahana Perry at Callen-Lorde and Erica Cardwell from Hetrick-Martin Institute. On the line now, we have Sheilah Sable, the Director of Community Education and Outreach at Empire State Pride Agenda. Good morning, Sheilah.
Yes, hi.
Thank you so much for joining us this morning.
Good to be here.
So, can you tell me a little bit about the history and mission of the Empire State Pride Agenda?
Sure. The Empire State Pride Agenda is New York State's statewide lesbian, gay, bisexual, and transgender civil rights advocacy group. We are actually celebrating our 25th anniversary, advocating for equality and justice for all LGBT New Yorkers and our families. We were significantly involved in the passage of major legislation like marriage equality, dignity for all students, and Sexual Orientation Non-Discrimination Act. And our current priorities include the Gender Expression Non-Discrimination Act and a LGBT protections bill for young people that would ban conversion therapy, the harmful practice against our youth.
Excellent. And what does your role encompass at the Pride Agenda?
Sure. So I am the Director of Community Education and Outreach, and that includes organizing and education within the community, talking to people about, how they can help support policy and legislative advocacy changes that protect our community. I spearhead the implementation of Lobby Day. I work closely with our communications folks to craft messaging around what brings allies into the fold. I, work with faith and labor and workplace to bring in allies and, supportive voices to, bring the message to the New York State Legislature.
Excellent. And from your work, can you give us kind of an idea of the picture of kind of the lives and challenges facing transgender individuals in New York?
Sure. So, the Gender Expression Non-Discrimination Act is a piece of legislation that we're advocating for. It's a bill that would protect transgender and gender non-conforming conforming New Yorkers from discrimination in areas of housing and employment and public accommodations, education, and credit. And, many people think that this already exists in New York State. That's actually not true. We lag behind nearly a third of the country in passing legislation like this. And it's so important, based on what the two folks before me were talking about in terms of a community that is, incredibly brilliant and resilient and thriving, but also dealing with harassment on jobs, on job sites at the rate of like 75% of transgender New Yorkers report being harassed on the job, 20% losing their jobs, 20% being denied promotions, 20% being denied housing and apartments. Nearly 20% of the trans community are homeless. More than half have experienced harassment and discrimination in public places. And then there are things like access to medical care. One of your spokespersons alluded to the need for cultural competency when providing medical care. So 17% of trans and gender nonconforming New Yorkers have been refused medical care because the medical providers that they're dealing with that aren't at Callen-Lorde, just don't know how to treat healthcare needs of trans people, which aren't really all that extraordinary, but people think they are. And then there's all kinds of marginalization and misunderstanding and a lack of respect and consideration.
Thank you. And how does GENDA, the Gender Expression Non-Discrimination Act, in terms of hopefully the ultimate implementation of that act, how would that work to address those challenges?
Well, it's a basic civil rights bill. So the passage of this piece of legislation would outlaw discrimination based on gender identity and expression in the workplace and access to housing and healthcare and public accommodations. And I like to think of it much like sexual harassment laws, right? When we got sexual harassment laws on the books, it certainly didn't stop, but it gave us a very strong jumping-off point to talk about these things in the workplace, in housing, and really make it so that we are educating about the needs of this community and what it takes for a workplace to be inclusive, so that people feel safe and productive and are able to be, part of society. And also it sends a message that we're all valuable, right? Because right now it's not equal, and certainly it gives us a very strong jumping-off point when this legislation passes, hopefully this year.
Thank you. And what is the status of this act?
Well, Genda has been around for about 13 years and has the full support of the New York State Assembly. They've passed it 7 times in the last 7 consecutive years. Governor Cuomo made a pretty strong statement in his State of the State that we definitely need to have this legislation, and he supports it. We are very hopeful that he will be an even stronger advocate for this piece of legislation. And the roadblock really is the New York State Senate and the conference leader and the Republican Party of the New York State Senate. So and New York State has a long history of passing all kinds of LGBT legislation with Republican governors, Republican controlled Senate. So this one should really be a no-brainer, especially because, like I alluded to earlier, it's one of the folks I was talking to yesterday in the New York State Senate said this is a blight on New York State that we don't have this. We call ourselves the beacon of civil rights, and yet we lag behind a third of the country. So hopefully, state legislature will hear that message from us in various different ways.
And how can folks get involved and support your work around gender and your other work as well?
Sure. So the biggest thing that I can talk about is our upcoming Lobby Day in April. Equality and Justice Day is at the end of April. We've done this now. Pride of Gender's been around for 25 years. E&J Day is probably over 10 years old. Each year, 600 or 700 folks come to Albany to advocate for legislation, protections, and you can get involved by coming to E&J Day. It's in Albany. Half the participants come from New York City, and half the rest come from all over the rest of the state. And it's an opportunity to advocate, meet your legislator, look them in the eye, tell them your story, tell them why gender is important, tell them why conversion therapy is an outrage, and it's also an opportunity to network and advocate. We have a rally. There's a conference component. So that's one way to get involved. You can go to our website and find our petition that is signed by nearly 12,000 people in this, advocating for, asking for the state Senate to bring gender to the floor and pass it. Also advocating for the protections bill banning conversion therapy. So those are 2 ways. Coming up on Thursday, actually this Thursday, March 12th, there's a statewide Gender Action Day. All of the cities and municipalities around the state that have protections, there are 11 of them that already have protections in place for trans and gender nonconforming folks. They're having there's several press conferences around the state, and there is one in New York City at noon on City Hall steps, and you can show up there and show your support for the City Council and their message to the New York State Senate to bring gender to the floor and prioritize this bill.
Excellent. And just so folks know, their website is prideagenda.org.
Yes, thank you.
And thank you so much, Sheilah, for calling in. We really appreciate you taking the time today and for all of your great work.
Thank you, and great show. Appreciate it.
Thanks. And just a reminder to those listening, you can call in and ask questions. The number is 212-209-2900. So now some final thoughts.
Sure. I mean, I was just thinking when we were listening to Sheilah talk a bit about the gender law. In my own work, there's often a distinction between how New York City runs and New York State runs, right? So that can cause a lot of confusion for folks when they're trying to access jobs, housing, employment, things of that nature. Those laws are not uniformly enforced across the board, and that is also found within the city as well. So, a lot of city agencies have been also quite transphobic against folks that are coming in just to access basic services that, they all have a right to. I just wanted to make that distinction that, we look forward to the passing of gender in New York State so that all of our patients, anyone that I work with, can access things as needed. Go ahead.
If I can just add to that, it's a really great point. In New York State, there's a patchwork of protections, right? So 60% of the state is protected by local ordinances and 40% are not. But what that looks like is all of downstate except for Nassau County. And then all of downstate has protections, and most of upstate does not, except for the bigger cities like Albany, Rochester, and Buffalo, Ithaca, and so on. And so, moving from county to county is a challenge. If trans people are traveling from New York City to Albany, their ride, something could occur where they are in a county where there are no protections. So it's a ridiculous way of parsing out civil rights, if you will. And the press conference on Thursday is really an opportunity for cities like New York to say, hey, we have this legislation here. It's good for us, and it's great for New York State. So that's really the thrust of what's coming up on Thursday, and I appreciate you put up that point.
Sure.
I can also say that, I guess, sort of on the ground with our young people, we went to Equality and Justice Day last year, and we had a really insightful and powerful experience, and I'm hopeful to bring our Women Speak program to Equality and Justice Day again this year. The one thing that's been exciting within our third year funding with the New York Women's Foundation is that we're actually able to build some clear connections within our community of woman-identified youth, and hopefully even develop some sisterhood. So as we are coming from different perspectives of womanhood, we can develop ourselves as allies and see from a cisgendered and transgender perspective how we can work together to support one another. And when we get in spaces like E&J Day and other forums, it's really important for cisgender women, young women, to be able to see the really intense barriers that their trans sisters are facing. And so I think that that's been something that has opened up completely within our population of young women and has really developed a removing this like invisible barrier and helped the groups to recognize a lot of the similarities and how they can support one another.
Yeah, I think, you're speaking to the diversity within the community. I think oftentimes the narrative is more of a broad sweep, and that, there really is a diversity within the LGBTQ community, and, incorporating that into your work, as you've said, is critical. We have a caller. Good morning. Hello?
Yes, I wanted to make a comment.
Yes, your name?
My name is Steve.
Hi, Steve. How are you?
I'm okay.
So your comment?
Well, my comment is just not to get the elderly in that community, in the LGBT community, and the abuse, and sometimes they get lost. When we think about it, most times we think about young people who can move around a lot, but I did outreach with elder abuse, and we did talk about them, and what happens to the people in that community that get lost as they get older. You know what I mean?
Mm-hmm. Absolutely.
Yeah, that's certainly an issue. I work with the adult population at Callen-Lorde, so I work with folks who are age 18 to, sky's the limit, I suppose.
Right, exactly.
Yeah, and, there are differences. Once you begin to age, you really do need to, there are different needs that are, that really need to be taken into account in terms of health and things of that nature. And I do find in my work that after a certain while, folks do kind of get swept under the rug and kind of lost in between the cracks. And so I think that you bring up a good point in terms of providing care for folks who are older as well. And I think just to add to that point that sometimes young folks that are not often prepared to face the world on their own once they come out of certain programs and things of that nature. So I would love to see personally more attention to continuing services for, continuing services essentially for folks who are young people that are coming out of programs that are transitioning into adulthood and beyond to kind of, lay the groundwork that's necessary for.
Right. And which let me just segue into that it goes into also benefits. Because you have a lot of people who have good, loving relationships for years, and when they become elderly, they don't have the Social Security, they don't have the pension, they don't have the, of their loved one, and they're lost. A lot of them become homeless.
Absolutely.
Yeah, it's very important. Okay, thank you so much.
Sure.
Thanks, Steve.
Okay. Yes.
I guess to kind of add to that, there is an organization called SAGE, which focuses on LGBT community elders in the city of New York. So luckily there is an organization, but that's one that we know of for sure, and certainly there needs to be more attention brought to that.
And I would also add that GRIOT Circle, GRIOT Circle, is another organization doing great work around those issues. So thank you, Steve, for bringing that part of the conversation in. We appreciate it. Sheilah, are you still on the line?
I am.
Any final thoughts from you?
No, I think this was a really great panel. I really appreciate that you included these issues in, what is a platform for International Women's Day or History Month and so forth.
All right, thanks so much, Sheilah. And Erica?
I think that just to speak to the next steps component, after you exit a youth program, where do you go? I think that's something that within our organization we reimagine over and over again, because it's something that we are really concerned about. And we understand how safe and important our space is and how much our young people really rely on what we have, not just on a really concrete, sort of housing referral or mental health counseling, but just in the feeling that you are included somewhere. And so when the moment comes and a young person reaches their 25th birthday and they exit, we do our best to really make that a community acknowledgement. And it's challenging because last year we had 2,000 young people, so we have a lot of young people that do age out that we're not always able to catch. And also, youth are individuals and they're going to age themselves out. But I think it's definitely something that we look at and really tailor to each young person as much as we can, because I think that is a critical piece, and it's certainly on our minds as we do competent youth work.
Absolutely. And Dahana?
Sure. Just to kind of piggyback on that, I appreciate that there is definitely attention paid to that, because there's no template really for trans people to follow. I think that it's very easy for cisgender individuals and for heterosexual individuals to follow a path that's been laid out for them, and that doesn't really exist for LGBT folks. It really doesn't exist, especially for trans folks. We're all kind of figuring it out together on our own in a lot of ways. So the path is really just beginning, I think.
Thank you both so much for your time today, and thank you, Sheilah. We're just about out of time, but thank you for your time today. Thank you for your critical work, and thank you to WBAI and Saidiya McLaughlin for all of your work in support of this programming. Thank you to all the listeners for tuning in. You can join us next week, Tuesday, March 17th at 10 a.m. for a conversation on issues facing the immigrant community. You can stay up to date on the participants and the work of the New York Women's Foundation and all of our grantee partners by visiting NYWF.org and following us on Twitter at NYWomensFDN. Again, my name is Gail Black, and thank you for joining us today. Have a great week.
I'm going to take liberty. So, Gail, what do you do at the Women's Foundation?
I'm the public communications manager.
And how does that fit in for a Women's
So
History Month?
how does that fit into Women's
you.
History Month? So I oversee our public education initiatives. So those are our reports and our public programming. And the goal is really to educate the community on the great work of our grantee partners, on the issues that they address, and how different partners across the field and the community and the public can get involved and move forward with our mission. So thank you, Saidia, for that. I appreciate it.
Thank you.
So I thought you were each going to give your contact information one last time.
Sure. Again, I am Dahana Perry, and I can be reached at Callen-Lorde. Phone number is 212-271-7200. That's the main line at the health center if you would like to become a new patient, if you have questions, things of that nature.
And my name again is Erica Cardwell, and you can reach me at you can go to hmi.org to find out more about our organization. Our phone number is 212-674-2400, and that is our direct line, and then you can be referred to whatever services you need.
Excellent. Thank you. Go ahead, Sheilah.
Sheilah Sable, Empire State Pride Agenda. You can reach me at 518-472-33